healthcare workers are once again sounding the alarm when it comes to low staffing and a lack of available hospital beds in Ontario. The Ontario Council of Hospital Unions, along with CUPE, were in Hamilton today saying the Ford government's approach isn't meeting our growing population needs, and the worst is yet to come. Sean Cowan joins us from McMaster Children's Hospital with more. Sean.
Matt, the union says there are two main reasons why hospitals are understaffed, and it has to do with our population. Not only is our population growing, but also aging, and the union says our healthcare system can't keep up. The Ontario Council of Hospital Unions says staffing shortages, along with hospital capacity and a lack of beds, are just a few of the key issues that hospitals in Ontario are facing. They say the province needs to invest more because patients are currently impacted, and it's just going to get worse.
We're now hitting a time where the first baby boomers are going to turn 80 this year. And the oldest part of that demographic of the elderly population drive healthcare at a very high rate.
They say Ontario's level of care is falling short compared to other provinces.
Well, I mean, we're well behind the rest of the country. To bring you up to the average of the rest of the country, you'd have to add about 4,000 staff in, Burlington, West Lincoln, in Milton and Oakville, and the Hamilton hospitals and Bradford. So, I mean, this is a large number that you're short, and people experience that in terms of being pushed out of hospital when they're still acutely ill, languishing on waiting lists for surgeries or diagnostic procedures. I mean, that's what people, that's how they experience it.
Jillian Watt represents almost 5,000 support staff at Hamilton Health Sciences, and she says her members are burnt out.
They are overworked, and there is a lot of overtime. There are, staff who aren't taking breaks, who are skipping lunches. It's really unfortunate because that's the break they need after a long day, typically on their feet.
Are a lot of people getting into the healthcare industry?
A lot of people are leaving the healthcare industry, and there are some who are hesitant to get into the healthcare industry because of what's going on.
CHCH News did hear from the Ministry of Health today. In a statement, it says the government has spent $85 billion this year alone in healthcare. There are 50 hospital development projects across the province and over 3,500 new hospital beds since 2020. But the union says if you break down those numbers locally, the Hamilton area needs more beds for the growing and aging population.
Burlington, Milton, Halton, Bradford, Hamilton, the government's probably planning for you to get 375 beds, and we're saying you need about 2,000.
And the Ontario government says over the last 2 years, they've added 32,000 new nurses. But the union says that's still not enough to keep up with demand. I'll send it back inside to you.